Why are childhood vaccine rates dropping? CDC report explains 2025 crisis. A troubling trend is emerging. Childhood vaccination rates have hit an all-time low, according to recent CDC data. This decline isn't just a statistical anomaly. It's a growing public health concern that has sparked intense debate. Last school year, the percentage of children skipping recommended vaccines rose again, continuing a post-pandemic shift where more families are choosing to avoid immunizations. https://7interest rate /www.nbcnews.com/health/health-news/Trump-vaccine stance-health crisis-children experts warn RCNA 17848. During the 2024-25 academic year, 4.1% of kindergartners, approximately 138,000 children, received vaccine exemptions, surpassing the previous record high of 3.7% from the prior year. Most of these exemptions are labeled non-medical, meaning parents aren't citing religious or personal reasons for avoiding vaccines. Instead, they're often tied to philosophical or ideological beliefs. This data comes at a critical time. 2025 has seen the highest number of measles cases in 33 years, with 1,333 reported in 39 states. https://www.cdc.gov, Measles Data, Research Section 5 Yearly Measles Cases. Dr. Richard Besser, former CDC director and president of the Robert Wood Johnson Foundation, warns that the trend is likely to worsen as long as Robert F. Kennedy Jr., a prominent anti-vaccine advocate, remains in his role as Health and Human Services Secretary. These numbers are alarming, but they barely scratch the surface of the damage Secretary Kennedy could inflict on future vaccination rates, Besser said. No one has done more to fuel fear and distrust of vaccines. HHS spokesperson Andrew Nixon countered, that couldn't be further from the truth. He emphasized that vaccination remains the most effective way to protect children from preventable diseases like measles and whooping cough, which can lead to severe health complications. A family's decision to vaccinate is a deeply personal choice, he added. The CDC also revealed that around 286,000 kindergartners lack documentation of their measles, mumps, rubella, MMR vaccine, a vaccine typically administered in 2 doses starting at age 1. These children were toddlers during the pandemic, which may have disrupted routine immunization schedules. Last year, only 92.5% of kids received their MMR and polio shots, and 92.1% were vaccinated against tetanus and whooping cough, both percentages representing declines from the previous year. Even small drops in coverage can have big consequences for preventing diseases like measles, said Josh Michaud of the Kaiser Family Foundation. Lower vaccination rates are a major driver of outbreaks we're seeing across multiple states this year. Measles is one of the most contagious viruses on Earth, requiring at least 95% community immunity to prevent outbreaks. While state requirements vary for public and private schools, https://www.nbcnews.com/healthnews.religious-loopholes-exemptions RCNA 212334. Most include core vaccines like MMR, polio, chickenpox, and DTaP, which covers diphtheria, tetanus, and whooping cough. Erica Edwards, a health and medical reporter for NBC News and Today, highlights the urgent need for clarity and action as the nation grapples with this complex issue. But here's where it gets controversial. Should public health officials prioritize scientific evidence over personal beliefs when it comes to vaccination? And this is the part most people miss, when the stakes involve protecting entire communities from deadly diseases. What's your take? Share your thoughts in the comments below. RFK Jr.'s influence. CDC vaccination drop measles outbreak warnings. Our children's invisible shield against once devastating diseases is thinner than it has been in decades, and the latest data, released quietly by the CDC, confirms a deeply worrying trend. New figures for the 2024-2025 school year reveal that vaccination coverage among America's kindergartners has slipped yet again. Specifically, the rate for the crucial measles, mumps, and rubella MMR vaccine now stands at 92.5%, a seemingly small dip from the previous year's 92.7%. While a fraction of a percent might sound insignificant on paper, in reality, it represents thousands of newly vulnerable children and extends a dangerous downward slide that puts entire communities at risk. Let's put that into perspective. This small decline contributes to an estimated 286,000 young students entering school without the full protection that modern medicine offers against measles. This isn't just a theoretical risk. It has real-world consequences. As these vaccination rates have fallen, the country has been battling numerous explosive measles outbreaks. In fact, the number of cases recorded in 2025 has already surpassed every other year since the highly infectious disease was declared eliminated in the United States back in 2000, reaching a staggering 33-year high. And this is the part most people miss. Public health experts aren't just chasing arbitrary numbers. There is a critical threshold for protection, often called community immunity or herd immunity. For a virus as contagious as measles, that magic number is 95% coverage. When a community hits that target, the virus has almost nowhere to go, which protects everyone, including infants too young for the vaccine and people with compromised immune systems who can't be vaccinated. As recently as the 2019-2020 school year, the nation was meeting that 95% benchmark for MMR. Since the pandemic began, however, that protective wall has been steep. Vaccination rates among kindergartners fall to alarming levels. The alarming trend of declining vaccination rates among kindergartners is raising significant concerns, especially as the number of exemptions reaches unprecedented levels. The situation is not just a statistic. It has real implications for public health and community safety. Recent data released by the Centers for Disease Control and Prevention, CDC, reveals that during the 2024 to 2025 school year, vaccination coverage for kindergartners has dropped across all reported vaccines compared to the previous year. Specifically, only about 92.1% of kindergartners received the diphtheria, tetanus, and acellular pertussis vaccine, DTaP, while 92.5% were vaccinated against measles, mumps, and rubella, MMR, and polio. These figures represent a slight decline from the prior school year, which is concerning given the current health climate. This decline in vaccination rates coincides with a troubling surge in measles cases, the highest the United States has seen in over 3 decades. A significant portion of these cases is linked to an outbreak in West Texas, predominantly affecting unvaccinated children and teenagers, or those whose vaccination status remains unclear. Experts warn that as vaccination rates continue to fall, the likelihood of outbreaks increases. Alarmingly, current vaccination levels have dipped below the critical 95% threshold necessary for herd immunity, which is essential for protecting those who cannot be vaccinated due to medical reasons. Moreover, the data indicates that exemptions among kindergartners have also reached an all-time high, rising from 3.3% to 3.6% in just 1 year. This increase in exemptions was observed in 36 states and Washington, D.C., with 17 states reporting exemption rates exceeding 5%. This trend raises questions about the growing hesitancy towards vaccinations and the potential risks it poses to public health. Dr. Celine Gounder, a medical contributor for CBS News and an editor at KFF Health News, expressed her concerns regarding the rising number of exemptions during a segment on CBS Mornings. She emphasized that many of the fears surrounding vaccinations are unfounded, stating, "We're really seeing a lot of exemptions and concerns about vaccination that are not warranted." Dr. Gounder reassured the public that the MMR vaccine is not only safe, but also highly effective, providing lifelong protection against measles, one of the most contagious diseases known. As we navigate these troubling statistics, it's crucial to engage in open discussions about vaccination. What do you think about the rising exemption rates? Are there valid concerns that need to be addressed, or is this a misunderstanding of the vaccine's safety and efficacy? Share your thoughts in the comments below.